Barnaby here, another HelloLife moment for you with my associate, Dr. Jeffrey Chamberlain, who is a family doctor. Doc, I got this pain in my shoulder. What do I do about it?
But osteoarthritis pain is a really common problem for adults to have, and it's something where it's nagging. It can happen for a little while, or it can happen for a long time, and it can be an annoying pain to have. The most important thing to do, though, is always start with the safest treatment possible. And so kind of just going through the list of starting with the safest things and moving from there. The most important thing with people with arthritis type pain is to make sure you're at a healthy weight. And so it's the hardest thing to do, but it's honestly the most important thing to do. You know, after that, if it's a specific joint, doing physical therapy that's really dedicated to that joint, and having someone who's an expert on physical therapy look at it to figure out what's generating the pain, and coming up with a strengthening and stretching routine that's going to help that out.
Yeah, in this slide, I just had reconstructive shoulder surgery about 4 months ago, and it really is markedly better, but boy, I've kind of fallen off the bandwagon with the exercises, and I can really tell, because now it's going to be maintenance, probably making sure it stays limber, good range of motion, so that's a good point.
Yeah, that's right. And that's right, it's not just doing the physical therapy once or twice or going in a few times, it's really figuring out a routine to do every day to help you to stay healthy in the long run.
Yeah.
Another thing is tai-chi, which is it's a Chinese special type of martial arts, which is kind of a stretching yoga martial arts combination. Not exactly for tai chi experts, but that's a good way to describe it. It has a lot of evidence that it really helps people out with arthritis type pain. So that'd be a good thing, a good practice to learn and start doing on a daily basis.
Yeah, 'cause it's all about movement. I mean, you were born to move, and when you get sedentary, I think necessarily we start stiffening up. So let's say that we have just like a little bit of wrist pain, or some elbow pain, or some knee pain. Do you advise some sort of like topical applications to minimize?
Exactly. Topical applications, kind of like HelloLife's Painazole, is helpful because, again, we're localizing the pain, and we're not treating our whole body, we're treating the specific area of the pain. So that's a really good option to do. For things for treating the whole body, you know, there's a lot of people who say that taking a combination of cinnamon and honey in a cup of water every day really helps their arthritis type pain. So that's a natural approach to something that someone could try.
That's got to taste pretty good, I would think, right?
Yeah. Exactly.
And then, you know, being an inveterate runner, I take the kind of the prophylactic approach where I'm taking glucosamine, chondroitin, because you hear, and that's how I think how I frame it, you hear that it's good for you, is it?
Yeah. The studies do show that the combination of the two, the glucosamine and chondroitin together, really does help prevent and reduce the amount of aches and pains that people have in joints. So that is actually a really good thing to keep on doing.
That's cool. I'll keep popping those pills. Thanks so much, doctor. And you know, coming up, we're going to be talking about something that's near and dear to my heart, and that is pain relief in kids. What to do about that if they have joint pain or fevers and that sort of stuff. Because here at HelloLife, we're all about really nurturing you along with your journey towards a more healthful way of being through the use of natural medicines and supplements. So definitely make it a habit to keep checking back in, because this is a good habit forming sort of a thing, isn't it, Doc?
It is. It really is.
Absolutely.